Hello everybody, my name is Kaylee. I'm one of the midwives here at the RVI. This is just going to be a short introductory video explaining exactly what to expect on the day of your caesarean section. So 2 days before your caesarean section you will get an appointment for a COVID swab, and then the day before you will get a phone call from the delivery suite to tell you exactly what time to come in the morning for your caesarean section. If you've not had that phone call before 7 o'clock, we'd probably advise that you chase this up by ringing either the labour line, delivery suite or maternity assessment unit. The next part of this video is just going to be a short little walkthrough on what to expect on the day that you come in. I really hope that this has answered all of your questions, but if you have any more, please don't hesitate to contact Connie or to ring your community midwife. On the day of your caesarean section, you will go to the Leazes wing, up to level 4, where you will arrive at the maternity reception desk. On arrival at maternity reception, the ward clerk will confirm your details, complete a track and trace form and provide you and your partner with a new surgical mask. On arrival to the delivery suite, you will be welcomed to enhanced recovery, which is a bay with 4 beds in. A midwife will prepare you for theatre. This includes a set of observations, a checklist of questions, ensuring the consent form has been signed by both the doctor and yourselves, and listening to your baby's heartbeat. You will then be seen by the surgeon and the anaesthetist who will be performing your surgery and anaesthetic. In the morning, the theatre team will have a meeting to decide the order of the list depending on clinical need. There may be delays in the running of the caesarean list if the delivery suite is busy, and emergencies needing to go to theatre will take priority. The midwife looking after you will keep you as informed as possible. When theatre is ready for you, you will be escorted to the theatre by a member of the team. Your birthing partner will be shown where to get changed into theatre scrubs while you are taken into theatre. Your birthing partner will need to change their bottoms, their top and their shoes, as well as wear a surgical mask and a hat for going into theatre. There are lockers in the changing room as well as a toilet. In theatre, a cannula will be placed in your hand and the anaesthetist will commence your anaesthetic. The midwife will listen to your baby's heart rate again and insert a catheter into your bladder. A checklist will be completed to ensure all staff are happy to proceed prior to commencing the surgery. Delayed cord clamping is routinely carried out. Your birthing partner will unfortunately not be able to cut the cord, as is done in a sterile area. However, they will be offered to trim the cord. The midwife will complete an initial examination of the baby, weigh the baby and take the baby's temperature. You will be offered to have skin to skin with your baby in theatre. Staff will facilitate taking pictures of the baby in theatre, but trust policy will need to be adhered to, i.e. pictures mustn't include any staff members and filming is not permitted. It is important to discuss with the doctor performing your surgery as to what they would feel comfortable of you taking pictures of. You are usually in theatre for approximately 1 hour. From theatre, you will be taken to the main recovery, where you and your baby will be cared for by midwives and anaesthetic staff until your anaesthetic has worn off. You are usually in main recovery for approximately 2 hours. If suitable, you and your baby will return to enhanced recovery. At this point, your birthing partner will be asked to leave the department. They will be able to return during your allocated visiting slot on the postnatal ward. This is usually the next day. If you are not suitable for enhanced recovery, you and your baby will be transferred to the postnatal ward. At this point, your birthing partner will be asked to leave the department. They will be able to return during your allocated visiting slot as discussed earlier. In enhanced recovery, refreshments will be provided. Your routine observations, your blood pressure, pulse and temperature will be taken. A midwife will provide you with support to feed your baby, A midwife will complete a more detailed baby check. You will be assisted to mobilise out of bed, and if you are able to do this and are happy to, your catheter will be removed. At this point, you and your baby will be transferred to the postnatal ward. We hope this virtual tour has been useful and eased any of your uncertainties. If you have any further questions, you can speak to your community midwife or ask your very own e-midwife Connie on Facebook.